Hi there. This is Aaliyah Oseron from Box for Health, and I would like to update you and introduce many of you to us. So I think one thing we can all agree on is that kids deserve a healthy childhood. Education and the promotion of healthy living is a way to prevent problems before they strike at a low cost and maximum impact. And when we at Box for Health look around the world, we see inequities that disproportionately impact children living in low and middle income countries. While many programs exist to help through short-term interventions, providing long-term health education resources is scarce. And that's why we founded Box for Health. Box for Health is a nonprofit organization that strives to improve lives through health education and service. We believe that knowledge is multidimensional and that a lack of knowledge on healthy living is detrimental to a child's success. We developed an in-school curriculum that can impact lives in an astonishing way. As health professionals and public health experts, we know that change starts with education. That change is accelerated with resources and repetition. We also realize the importance of maintaining an eco-friendly and green initiative to avoid unintended consequences that harm our planet more than help it in the long run. When we teach children the fundamentals of healthy living, we provide them with biodegradable, sustainable, and eco-friendly hygiene products. Through health education and hygiene instruction, we hope to significantly curb the spread of related diseases and to improve the quality of life of thousands of children. Box for Health combines an innovative model of health education with an eco-friendly brand of accessories as well as a subscription service, making our company as sustainable as our products. Using a multifaceted strategy, including public health channels, we deliver a unique yet simple model for health education. In the past few weeks, we've really expanded our brand. We've worked on initiating our pilot, and we're working on developing a more comprehensive marketing strategy. We've improved our pre-existing business plan to fit our new needs, and we've expanded our talented team. We launch our full intervention this fall with 1,000 children in Lebanon, and we also launch what we're calling our limited initiative, including 100% of the health education resources that Box for Health created, with 3,000 children in Burkina Faso. As our network and our sales increase, we hope to more than double that service in the fall of 2021. When we at Box for Health think about our product, we divide the market into 3 distinct categories: children served, donors and foundations, and then our product customers, those who buy what we sell online. To serve our mission of global health education for children served, Box for Health combines health education with hygiene initiatives to serve low to middle income countries. Our model of action focuses on partnerships and sustainability. By partnering with local nonprofits and schools, we collaborate, creating a more scalable and sustainable program. Our lesson plan books are customized for each country we serve. Using the country's global burden of disease and disease-adjusted years, among other data, we find a nonprofit organization that shares our vision for the future. That means not only do we look at which diseases are children dying from, but we also look at which diseases decrease quality of life and are causing disability within that nation. Next, we send out our letter of introduction to the nonprofit. We deliver an instructions manual that clearly lays out our mission. It also informs the partnering nonprofit of what they're going to be required to do to help drive health education forward. Among these requirements is finding a school that they can work with and we can work with to implement the program. Our program is aimed for maximum impact with minimum effort on the host country. In-country nonprofits often have existing relationships with several schools in the area. Based on fit and financial constraints, we roll out the program. First, only providing hygiene material, the limited program. We request that the schools use the instructions manuals, and we request that they submit bi-weekly reports, including photos and feedback. Regular reporting is a requirement to receive the full Box for Health initiative. So let's talk about the nonprofits that we target. For example, let's talk about Abdul Aziz. He is a 30-year-old male living in northern Lebanon and works at a nonprofit organization. In his country, the unemployment is skyrocketing. Smoking rates in children have never been higher. The future looks grim. He knows that education is the best path forward, and his 2 kids are enrolled in the best school he can afford. He pushes them hard in hopes that they will continue to create a positive ripple. Abdul Aziz works hard for his community, and after working for Al-Musadat for 10 years, he was selected to be its executive director. Abdul Aziz wants to prevent children from smoking and help them lead healthier lives in general. During his search on how to do this, he finds Box for Health and is ecstatic. He contacts us via email. With Abdul's guidance, we were able to choose a school, and based on an introduction letter and a checklist we provide, we assess the available resources on location at that school. Next, we deliver program materials and request that the schools use the instructions manual as well as provide feedback. If possible, Box for Health also asks the partnering NGO, in this case, Al-Musadat, to pay for part of the shipping cost to ensure buy-in. Now, when we visualize and chart out our growth, we see our impact in an exponential fashion. We project that after our pilot year of serving 4,000 children, we will grow to serve 10,000 children. Due to our uniquely cost-effective model, we project to double the amount of children we serve each year, reaching 20,000 in year 3, 40,000 in year 4, and nearly 100,000 in year 5. Continuing to serve existing partners while adding new opportunities. We do require donations, and overall, Box for Health has raised more than $8,000 through donations and online sales. Our main source of funding thus far comes from friends and family who believe in our mission. To increase our impact to maximum capacity, we are looking for new donors. We plan to host fundraising events and drive forward with an online monthly reoccurring donation campaign. When we talk about donors, we can think about the December donors such as Mary. And this is her. She is 66 years old. She's worked as a registered nurse for years, manages the entire floor, and she really connects with Box for Health through its mission because her life's work is also in health education. Now, typically she donates about $3,000 a year to her favorite charities. And she's thinking about giving Box for Health an annual donation. And she typically likes to donate in the month of December. So as she's doing her Christmas shopping, she does her donations. Now, Mary can definitely be reached via mailer or phone, but the good news is, since she is running an entire floor at a hospital, she has used social media, including Facebook tools. So we hope to obtain more donors like Mary, particularly during our holiday drive. As we push our monthly donations to grow, we can think about this persona, Karen, Karen, as we like to call her. Now, she is a busy working mom, 48 years old and making good money, 85,000 plus a year. And it's through her children that she's really inspired to contribute to Box for Health. She sees her 9 and her 11-year-old, and she thinks about children all over the world who can experience a huge impact from a small monthly gift. Now, she checks her email regularly and stays up to date on social media, and this is actually how she found Box for Health. She saw a post and was inspired to become a monthly donor, and she wanted to help other children get the education and learn all of the health skills that her children are privileged enough to receive. Currently, our donations are around 7,500. By the end of September, we expect that number to be about double at 15,000. And by the end of the year, we expect that number to grow to be at least 25,000. As we look into next year's fundraising, we hope to obtain more donors like Mary and like Karen to push our budget by the end of second quarter to $50,000 and by the end of next year to over $100,000. In addition to donations, we want to have alternative sources of revenue streams. That's something that COVID has really taught us is sometimes people have other things more pressing on their mind than their typical donations. And so we also have these customers that we talked about that use our subscription service, or maybe they log on to our e-commerce site and buy a single product. What we really hope is whether they choose our aesthetic or eco-friendly single-time purchases such as bamboo sunglasses or biodegradable floss, we really hope that they'll upgrade to subscribe and help us save the world, one child at a time. Our subscription box service, which is currently in development, strives to improve the lives not only by funding education, but also by making it easier than ever for the eco-conscious consumer to get their hygiene materials. Each subscription box is comprised of a wide selection of aesthetic and eco-friendly toiletries and accessories. In addition, we'll include the occasional goodie such as an organic tea or bamboo sunglasses or other fun options. During the Tufts Venture Accelerator, we've really focused on our direct-to-consumer product line, and we even added a team member, Sosina, a Tufts student who is taking charge of the subscription services. Her passion for on-brand partnerships, design, and attention to detail will no doubt keep our products moving online and hopefully into retail locations as well. Yoga studios, meditation facilities, and other eco-conscious locations are all possible future places to pick up your box. Who exactly is buying these subscriptions? So green millennials like Jessica. She is a 30-year-old, well-educated professional. She often buys these green products, and it's really important to her that the company is responsible, not just that they're putting out a responsible product, but they're partnering with responsible entities. And she loves the idea that her purchase can do good. She often shops online at boxforhealth.org, and she also shops for her longtime live-in boyfriend. Now, Jessica is a great asset and a great target market, but she also likes to volunteer to create an even bigger effect. So we hope to not only have her buy our products, but also become a part of our brand. Now, we created our website in March. We had no sales traffic, no leads, starting from scratch, and did a soft launch of the products, and we're able to sell nearly $200 worth of product. We're now creating a very targeted marketing campaign, and by the end of this quarter, so the end of September, we are hoping to reach $1,000 in sales. And we have the help of some Google AdWords in-kind donations as well. Now, by the end of the year, we're going to go through a big holiday push, and we hope to reach $5,000 in sales. We also hope to have our subscription boxes up and running by then, which will make sales that much easier. As we get these sales, we're going to do interviews with customers. We're really going to understand that target audience. We're going to improve the user experience. And by the end of March 2021, we project $10,000 in sales. By the end of June, we'll be upselling and really honing in that customer experience. And as we all know, selling to an existing customer is less expensive, and we expect our sales to increase even more, up to $20,000. Now, you may be asking why we are so confident that we're going to succeed. And I'd just like to walk you through a little timeline of our company. Ideation actually began in May of 2018, and it started as a health initiative in Lebanon. After completing a needs assessment, those needs were presented to a stakeholder in Lebanon in October at the International Dental Meeting. Through the next year, additional contacts were made with the Lebanese Dental Association, the Ministry of Health, and development programs. The program evolved, and we decided to create a nonprofit in the state of Massachusetts. We were accepted into the Clinton Global Initiative University, which really helped provide mentorship and brought us to the point where we were ready to raise funds so that we could start taking action. And then in March 2020, coronavirus halted us in a big way. We lost our contacts in Lebanon as they isolated themselves. Our manufacturers in China were completely backed up by the virus, as well as trade restrictions. And that did not stop us at all. We pivoted into a remote delivery system and to create more automatic processes. We were greeted with good news in June when we officially received our 5013C status, and it was backdated to February, so all of our initial crowdfunding is tax deductible. In April and May and June, we knew that it was time to rebrand. We were still a very new nonprofit, and we wanted to better reflect our mission of global service. And we started creating the Box for Health complete concept. We had to create a new NGO partnership in Lebanon since we lost contact with ours due to their overwhelming burden of coronavirus. We were able to do that, and we were able to complete our lesson plan books. We also began the validation process, which includes public health experts, educational experts, and it includes translating as well. This curriculum book needs to be available in French for our first 4,000 children, and we hope to translate it into several other languages. In July, we began to deliver material to our NGO partner and really prepare for that in-school visit and that in-school delivery. We also shifted our model to accommodating the manufacturing process and the manufacturing space that we're dealing with. While this was going on, we were also contacted by another organization, the African Initiative for Youth Development, which is located in Burkina Faso in Africa. Now they have a partnership that will allow us to serve an additional 3,000 children. The problem was we did not have the funds at the time, and we hadn't planned on scaling up that quickly. So our dedication to service really drove us to pivot and decide to develop this limited program that I've been talking about, where the children are able to receive 100% of the health education that we created, and we hold off on the products until financial constraints and compliance constraints allow us to deliver toothbrushes, toothpaste tablets, biodegradable floss, and other health and hygiene materials to those students. We also will be performing a quality assessment of our model. As academics and healthcare providers, we really do believe that there's always room for improvement, and our quality assessment study was granted IRB approval from Tufts University. Finally, we're always thinking about our future. We're always trying to develop a more sustainable fundraising model. We're trying to expand our talented team, and I would have to say we're doing so pretty successfully. We're creating that subscription service, and recently we were recognized by Google nonprofits and received the Google ad grants of an in-kind donation of $10,000 a month in advertising. We want to spend that money wisely, and so we are developing a social media ecosystem marketing strategy that multiplies the money that we spend. That, combined with a search engine optimization plan, is really going to help us to serve 100,000 children in only our 5th year of operation. We're really excited to use this limited program during the first year to make sure that not only is the school a good fit for us, but can we help the school? Are we able to tweak the program to make it better for them? We want to continue our partnerships with eco and sustainable brands, and we're looking for validations of our public health model and public health initiative, with the hope that local governments are going to be able to buy into this program as an incredibly cost-effective way to teach health education, decrease mortality, decrease morbidity of associated diseases. We hope to continue to grow. We hope you will continue to grow with us and keep health close to your heart. And we just wanted to let you know that here at Box for Health, when we think about health, we're thinking about our company's honesty, energy, accountability, our laughter, our teamwork, as well as hope. There's nothing more powerful than a children's smile, and we hope that you'll join us so that all of our children may smile. Thanks so much for listening.